Hello, and welcome to a short video tutorial covering PPO Basics, with illustrated help from Ben. The term PPO is frequently used in today's healthcare landscape. So what exactly does it refer to? By true definition, a PPO, or Preferred Provider Organization, is a managed care organization of medical care providers such as doctors, hospitals, and other facilities who have contractually agreed with a health insurance company to provide patient care at reduced rates to that insurance company's clients and members. While PPO technically refers to a type of managed care network, it is more generally used to describe a type of health plan. The most attractive feature of a PPO is flexibility. As a member of a PPO, you may visit any doctor or facility in the network which you see fit without needing the referral of a primary care physician. All doctors and facilities within the PPO have pre-negotiated their fees for all aspects of patient care with the health insurance company. The result of this agreement is that you receive a substantial network discount for using these preferred providers. If you receive treatment from a non-preferred provider or out-of-network, you will likely experience higher out-of-pocket healthcare costs. PPOs have four key components which you should fully understand. These are copays, a deductible, coinsurance, and an out-of-pocket maximum. Let's take a quick look at each of these components. Copays are predetermined flat fees you, the member, must pay for certain services. While most commonly associated with doctor visits, copays could also apply to other services such as emergency rooms and urgent care centers. This flat fee typically covers any treatment received during a particular visit. Diagnostic testing such as labs and x-rays and outpatient surgical procedures may or may not be included in one's copay. If not included, these expenses would be attributed towards one's deductible and coinsurance limits. An annual deductible is the amount of money a member must pay for certain services before the health plan itself begins to pay for those same services. Most commonly, a deductible is applied to hospital services. A good rule of thumb is that a deductible would apply to any treatment not performed in a doctor's office. You should also be aware that a member would likely have separate deductibles for in-network and out-of-network care. After your deductible has been met, you typically will experience a coinsurance arrangement with your health insurance provider. This is simply a cost-sharing arrangement in which your health insurance provider pays a certain percentage of charges and you pay the rest. Similar to the deductible, coinsurance could be different for in-network and out-of-network providers. The final component of a PPO is the out-of-pocket maximum. Often referred to as a cap, the out-of-pocket max is the maximum amount of medical expenses you, the member, will be liable for during the plan year. Once this cap is reached, the coinsurance arrangement shifts so that 100% of all eligible medical expenses are now covered by the insurance carrier. It is important to understand that copays of any kind do not contribute towards the out-of-pocket maximum. Along these lines, you should also be aware that you will still be responsible for your copays even after you reach your out-of-pocket limit. These four components are the foundation of any PPO plan. Knowing and understanding these components of your plan will better prepare you to navigate the healthcare landscape. There you go. Now you know. See ya.